Is there any other way someone can gain their butt, their boobs, other than liposuction?
They either do it through a fat transfer or putting an implant, breast implant.
What part of the body can fat be transferred to?
You can be transferred anywhere. You can transfer it to your face, but the most common part is the hips and butt, and then the breast.
Does it really stay longer? Because I heard that if you transfer fat to your breast, it's more or less like you're wasting the fat.
You will lose majority of the fat that is transferred there. However, the ones that stays go. In Lagos, a lot of women want their butts big, really big.
For people that do fat transfer to their butts, how long is the healing process?
If we do a fat transfer to the bum, you cannot sit down on that bum for at least 8 weeks.
If you do sit, what will happen?
You're going to squeeze the fat and prevent it from growing.
Hello everyone, welcome to another episode of Be Inspired with Wunmi Elabote. My guest today is a cosmetic surgeon with over 20 years experience. He owned and operated the franchise such as Apple Tree Medical Center in Toronto and Toronto Medical Clinic in Ontario. He relocated to Nigeria in 2015 to start and operate Kleinburg Medical Center. He started as a clinic and now expanded to a full hospital in Victoria Island, Lagos, Nigeria. He graduated from University of Illinois Medical Center, resident at University of Toronto, Canada. And of course, he has numerous certifications such as American Academy of Aesthetic Medicine in Dubai, American Board of Aesthetic Medicine High Definition Liposuction Course, London, Liposuction Institute, Dubai, Mini Fellowship, Liposuction and Fat Transfer. Please welcome Dr. Akeem Anifowoshe. Dr. Akeem, I'm so happy to have you here.
It's a great pleasure to be here.
I know your schedule is kind of tight, but yeah. I'm so happy. So let's get the conversation started. So you have to tell me how you become a cosmetic surgeon, because this is relatively new in branch of medicine. Why did you go down that road?
Well, Nigerian women like style. See your hair. That's the reason why. Nigerian people, we like trending stuff. And it appears cosmetic surgery is one of those things that is trending now all around the world. And Nigerians are starting to catch up on it. So that's the reason why I went into it. I also have passion. Okay. I have passion for medicine as a whole. And I want it better. This is Nigeria. A lot of things don't work out right. So I came into the industry to ensure that if we're going to provide this service, it should be provided in a safe and providing international standard.
Right. Yeah, sure. So okay, let me ask this question. So before cosmetic surgeon, what were you? Are you a full-time?
I was a GP or a family physician. So I did all kind of medicine. I did everything. I did dermatology, I do internal medicine, pediatrics, obstetrics and gynecology. I did everything. And on the side, I had a med spa. Oh. A med spa is a place where you make people look beautiful by doing stuff to their face.
So it has always been part of...
It's always been part of me.
Oh, nice, interesting. So how do your family feel about it?
My family are okay. They're fine. They're okay. They're proud of me. I'm doing something different.
Okay. Could you please educate me? What's the difference between plastic surgery and the cosmetic surgery?
Thank you very much for that question. A lot of people get it confused. So plastic surgery is mainly focused on reconstruction. That's their background. Reconstruction of congenital problems. For instance, someone that is born without a hand, someone that's born with cleft leaf, those kids you see, or reconstruction of the body parts as a result of disease or injury. Someone that has burn, someone that has breast cancer, they do reconstructive breast. Oh. That is their background. However, some plastic surgeons also do cosmetic surgery. So cosmetic surgery is open to every branch of medicine. You just have to go out there and do the training that is required. My specialty is liposurgery and fat transfer. I do that, and that qualifies me as a cosmetic surgeon because of what I do.
So does it mean that you don't do tummy talk?
No, I don't do tummy talk.
Oh,
So if I have to do a tummy talk, I have to invite a plastic surgeon to come do it.
gotcha.
Or another cosmetic surgeon that does plastic surgery.
So your specialty is on cosmetics.
My specialty, I'm a cosmetic surgeon that focuses on liposurgery with fat transfer. That's
see.
what I do. And a subspecialty of that is awake liposuction. That is the liposuction you do without putting the patient under. This is achieved by numbing the area you want to do. For instance, your belly. We numb it the way a dentist will numb your gum before he pulls out
Right.
your tooth.
So all those places, no, they won't feel the pain
They
while the
won't-
process is
And it's safer.
in progress.
Makes it safer.
Amazing. That's so nice. What part of the body can fat be transferred to?
You can be transferred anywhere. You can transfer it to your face. But the most common part is the hips and butt, and then the breast.
Oh, so does it really stay longer? Because I heard that if you transfer fat to your breast, it's more or less like you're wasting the fat.
Well, you will lose majority of the fat that is transferred there. However, the ones that stays grow. Do you understand? So if we put a certain amount, you lose, let's say you lose 70% of it. The 30% that is remaining can grow.
So can you please elaborate more on, I know that a lot of people go for a section for liposuction or fat transfer, you called it. And then they kind of go back again, like have like 1, 2, 3, and then revisit. Is it kind of psychological effort or what?
Well, cosmetic surgery is meant to improve something that is bothering you, okay? It is not a perfect science. So sometimes when the surgeon does the work and the patient is not satisfied, definitely they're going to do it. For instance, in Lagos, a lot of women want their butt big, really big. So when we do the fat transfer the first time, and they lose some of the fat, the patient might feel somehow, ask you, doc, I want it really big. Then that patient has to do a subsequent procedure. There is a small fraction of people that have a bit of psychological issue that needs to be addressed before that may be making them wanting to do cosmetic surgery. The surgeon should be able to pick that out and refer that person appropriately to the right specialist.
So have you ever talked someone out of surgery?
Yes,
and why?
I do. Yeah, so liposurgery is not a weight loss procedure. So I've had a patient that is weighing 150 kg that believes that, sucking out fat from their arm, their thigh, their belly and back is going to solve the problem. And I say, no, it's not going to solve the problem. You need to go lose some weight.
So meaning that you advise the patient to first go for weight loss before they now come back. And then I'm sure a lot of them will not feel cool about it, but...
Yes, a lot of the majority of them do follow that trend if they really want to have their body resculpted. Yes.
So what now happens to the loose skin?
Well, if the weight loss is gradual, there's no loose skin. If it's sudden, if they do there's the gastric bypass surgery, that's sudden weight loss. Yeah, that causes loose skin.
So what is your opinion of people that say that, okay, improve self-confidence, they are doing it for self-confidence? Do you believe that notion?
Yes. So a woman who all her life has been called flat butt and now was going through the internet and one day sees a before and after of one of our patients and says, wow, I didn't even know this can be done in Nigeria. The patient comes in, we do a consultation. She's a good candidate. We do the procedure
What is your definition of a good candidate?
A good candidate is the one that is not doing it because they have some other psychological effect that is affecting them. So some people, there's something called body dysmorphic disorder. The patient looks perfectly okay, but feels something is wrong somewhere. You examine this patient, you don't see anything. You know, some patients come in looking perfect and they still want, and they've been to another surgeon already. And you examine the patient. So to me, this patient, no matter how I do her, I do the person, they're not going to be okay. They're still going to come back or go to another surgeon.
So meaning that you would decline?
I would decline that patient, yeah.
What is your opinion on a parent that allow their children to go through this process?
Okay. The parents need to consent, first of all. You need to be at least 18 or 19 before you can go out there to get cosmetic or any kind of medical procedure done. You need to be you need consent. And I don't think those children can go get surgery done without a consent. There's a condition called gynecomastia where a boy during his growing phase develops breast.
Right.
I mean, that is causing him problems. That one requires surgery. Although it's best to advise weight loss, but weight loss is not going to solve that issue. You need to actually take out the gland because the breast gland.
So that one is kind of understandable.
Yeah.
So
but a mother is not going to bring her daughter and says, "I want her to have a BBL," and I'm not going to do that.
Wow. Why won't you do it?
I just feel it's ethically, morally wrong at that age, whatever age it is. As long as that first of all, that child is still growing. You want to perform an elective surgery on someone that is still growing.
That's so amazing. Before the next question, we have to go on a short break, and we'll be right back. Stay tuned. Welcome back on Be Inspired with Omele Bote. My guest is Dr. Akeem. He's giving us detail about liposuction, how the whole thing works out. Enjoy. So, Dr. Akeem, can you please explain the process to me? So, after you take out the fat and then you transfer it to the area that the client wanted to be transferred to, and then what happens to the excess fat?
So it's discarded. Medically, yeah.
So have you ever had a client that after the procedure he's done and they were like, I don't think I like the way I look? Has that ever happened?
Yes, it happened.
Can you please explain what happened?
Well, I mean, I told you about a patient that wants to have a big butt, but has limited amount of fat. So after we were done, she felt her butt wasn't big enough. So I advised her to go get fat again, and then we repeated it. And when we repeated the procedure, she was okay. She wants it bigger. She wants it bigger like Nicki Minaj. She sees other people on TV whose butt is big. I'm like, mine is not big. But you didn't have enough fat to start out with.
Oh, okay. So another question I want to ask, for someone like me, I'm skinny and I don't have fat. I know I just want you to answer me. There's no stupid question anyway. So can I use another person's fat on my body? And then for people that doesn't have fat, and is there any other procedure, other way that they can increase their butt, any area that they want work to be done on?
Yes. So the standard before we started doing fat transfer, first of all, you can't use any other person's fat. We don't have that technology yet. Your body is going to reject it, and that can make you sick. If you it's like you're getting somebody's kidney, and you're not. So you will have to suppress your immune system, not to attack it. So you have to take medication every day to do that, and it's not necessary. So it's not done, you know. It's not like a life-saving procedure, like a kidney transplant.
Wow.
It's a transplant of fat. Okay, so your body will react to it if it's not coming from your body. Second of all, yes, so you can put a silicone implant in the bum. So skinny people that have bigger bum that do cosmetic surgery will have to do an implant.
So what's the disadvantage of that?
The implant has to come out at some point, has to be exchanged. That sometimes that's the only option for those people. They don't have any fat and they want to have bigger butt.
So what is this fat transfer? I transfer to my butt. How long will I have it? Like, is it going to be permanent? Is it going to reduce or something?
Yes. So once the fat is transferred to the bum, okay. So like just like I said, it's like you're planting a seed in the ground, you know. So that seed has to germinate and grow. So what happens is the fat that we remove from the belly, we put it to the butt. That fat needs to find a home in the bum. If the home is not suitable, is not conducive, the person is going to lose some of the fat. Okay, and but whatever stays after the initial loss of fat usually stays. Sometimes it even grows.
Wow.
Yeah.
So another question I want to ask is, for some people, they don't want to go under the knife. And then after childbirth, we realize that the whole fat just goes to your belly. Is there any other way someone can gain anything, their butt, their boobs, other than liposuction?
Yeah, other cosmetic procedures like an implant, like I said, that's one of them. When people gain weight, the weight goes to the breast, goes to the butt sometimes as well.
Wow.
I think that's about it. You know, if someone wants to increase the amount of breast they have, they either do it through a fat transfer or put in an implant, breast implant.
Is there any procedure someone needs to follow to maintain, even after your surgery? Is there anything someone needs to do to maintain it in order not to let it go away?
After the procedure, we add something called PRP to the breast. Most especially, some doctors actually add it to the butt as well. That preserves the life of the fat cells. You know, there are no creams, there are no herbs that you can use to increase your breast or your butt.
Because they are.
No, those are not going to work. Those don't work. You know, so you're wasting your money if you're buying that.
Right.
You might as well just save it and go and get the procedure done.
So let me go personal. You've seen a whole lot of women, different shape. How do you feel about it? What is the widest thing you've experienced in this field?
I think my disposition just shows that I'm a serious person. So people like that don't even get it. They don't. It doesn't happen. It doesn't happen in my practice. It has never happened. You know, so I don't have one of those wild things happening to me because maybe my disposition shows I'm a very serious person. So don't go to that guy.
So what's the message for people that doesn't trust the procedure in Nigeria to say that they always fly out of the country to get things done?
I don't blame them. A lot of doctors are coming back that have lived abroad, are coming back to Nigeria now. As you can see, during this time of COVID, a lot of people didn't have option other than Nigeria. And Nigeria, you know, a lot of doctors that are here in Nigeria were able to help them out. If they are interested in cosmetic surgery, it's very simple. You just book an appointment with maybe a couple of doctors. If you can afford to travel, fly out to go do it. You could book 2 or 3 appointments with different cosmetic surgeons, and you know, ask them questions, see their body of work, look at their facility, find out where they did their training.
Right.
and let them, from there, you should be able to measure. Going abroad doesn't mean they're better. Going abroad doesn't mean the facilities are better. Going abroad doesn't guarantee that you're not going to have complications. 'Cause every surgery has a certain amount of complication that is built into it. So it doesn't really matter.
So, like I said earlier, that this field is kind of a new branch of medicine for anyone that being a plastic surgeon or a cosmetic surgeon. What are the certification that is required? Like me as a client, as a patient, to say, how am I going to know this particular doctor process all this certification is highly certified? Is there anybody anywhere someone can check or something?
Yeah. So most doctors that have done the training process, if you go for a training, they give you a certificate of participation. So you look at that participation and then you call the body that issued it and say, do you have any record of this person participating in this training? I think it's as simple as that. Most of us have displayed our certificates in our offices.
So do you think that this new phase have negative impacts on the society?
We've had some cases in Nigeria, which is not unique. It happens in other parts of the world as well.
Right.
When something is new in a country, especially one that is traditional and conservative, and a lot of people don't get into it. They don't jump on the wagon quickly. They will say, you go and try first. So it's not that cosmetic surgery is new. It's not a new field, but it's a new field in Nigeria, right? So Nigerians are taking their time to come into it. Plus, when there is a complication, the media blows it, social media blows it. It doesn't happen in other specialty of medicine.
Right.
So all aspect of medicine has, they have their risk, benefits, and there's alternatives.
Right.
So, and all that is usually discussed at consultation. Unfortunately, sometimes, things go wrong.
So another question I want to ask is, some people, they don't want to go through tummy talk. They want to do liposuction, and their belly is kind of big. And I understand that after liposuction, there will be loose skin. Then they have to go through tummy talk. Will you advise such people to just follow the procedure, do this fast transfer, and then the tummy talk right immediately?
I have a lot of moms that I do that are afraid of tummy talk. I don't offer tummy talk. I work with consultant plastic surgeons who will do a tummy talk. I don't do that. But what I offer is laser skin tightening. So we suck up the fat and then we tighten the skin. And it improves. A lot of women, like 98% of my patients, end up not going for tummy talk. So the consultation goes like this. You know what? I know you don't want to do tummy talk yet. We have liposuction plus laser skin tight. You can just do liposuction and we can wait and see if, when you heal, will your skin retract?
Right.
And a lot of moms, they've had 2 babies, 3 babies. You just do liposuction and their skin comes back. There's no looseness of their skin.
Right.
Okay? Some people, and they didn't do the laser because they can't afford it. Okay? So they just do the liposuction. Then some people that can afford the laser will do the liposuction, then do the laser. Amazing results.
It has to be immediately.
We do it right there in the theater. Right there. It's so it's a laser that you put in the skin and sort of warms up the skin to a certain temperature. So to the point that when the body heals, it sort of helps with the collagen and elastin, which are the basic requirements for skin retraction. Okay, It helps build up the regeneration of those elements in our skin. So you do that right after. And so as the patient is healing, healing takes a few weeks.
Right.
So as the patient is healing, you see it's contracting. It doesn't give the same result as a tummy tuck, but you go home the next day, you don't stay in the hospital for 5 days, you can return back to work. There's really no downtime. And for someone that is not going to do tummy tuck anyway, you might as well do that.
Right, right.
Some people will actually do the liposuction first and tummy tuck. And if their skin is loose, they'll go, okay, if I don't like the result, then I'll go and do tummy tuck.
Right, that's additional fee anyways.
Yes. Well, it's best to stage your surgery. The more things you do, which is your second question, the more things you do, the more the chances of complication.
Right.
Okay. So, I don't know if you've heard this, where a mom would go have a C-section and cesarean section to deliver a child. And during that C-section, they do a tummy tuck.
Oh, Jesus.
Yes, that happens, and that's a big surgery. Your chances of having a blood clot, just those complications, chances of having complication increases exponentially when you combine procedures. I believe in staging. For instance, if you're big, lose weight first, and then come for liposuction. If you have loose skin, lose weight first, do liposuction, and then you go for tummy tuck. In good hands, in very experienced hands, they can do everything, and they have a track record of not having many complications.
So for people that do fat transfer to their butts or any realistic to their butts, how long is the healing process?
So if we do a fat transfer to the bum, you cannot sit down on that bum for at least 8 weeks.
If you do sit, what will happen?
You're going to squeeze the fat and prevent it from growing. That's the first thing. Second, depending on the amount of fat you put in there. If you put too much fat and they don't get oxygenated, it's not like the body so the fat can get infected and you can have abscess and infection and all that stuff. So it's quite important that you follow the instruction of the surgeon and elevate your bum with the cushion that you're provided with.
Oh, okay. They provide them a cushion after the procedure is completed. So I realized that, okay, you just want to do something. I just want to transfer fat to my boobs, to any area. And eventually people tend to come back for another thing. Do you feel that it opened people's eye to kind of look at it, that the area that they don't appreciate in their body to start doing? That's why some people do nose job, mouth job. What do you think about that?
Well, that was my profession, so I'm not going to tell you not to do it.
Right.
You're an adult. You're not disturbing anybody. It's your body. You can do whatever you want to do. But just note that, make sure you do it with the right person.
Thank you so much. I really appreciate for you being here. But final word, what are the word you have to give those people that are planning to take on this journey, but they are kind of skeptical? I'm going outside the country because I don't trust Nigeria, because I've heard a lot of bad news about the process. So what is the word you have for them?
The word is, you don't have to be afraid of Nigerian surgeons. Nigerian surgeons are well-trained, well-read. There are complications sometimes that happens with all surgery. Going abroad does not mean you are not going to be exposed to the same complications. The people practicing cosmetic surgery have a different mindset than the typical Nigerian hospital. So I think you should give them a try. Try and visit the facilities, speak with the surgeon before concluding on doing it. It's actually cheaper. You also help the economy. But I know your health is number one. But do book an appointment. See the surgeons available. We have about at least 5 surgeons in Lagos, including other guys that are actually flying. We have a few surgeons that are actually flying in from abroad, do procedures and go back. So that option is also there. So, so that you don't have to be in a foreign land recovering from cosmetic surgery. Okay? You also help our local economy. All right. So last word, meet with the surgeon, ask about his experience, look and verify his qualifications and his track record. I'm Dr. Akeem Anifowoshe. I'm the cosmetic surgeon. I'm the medical director of Kleinburg Medical Center. You can always ask, check me out on Instagram or book an appointment. Come and see me for a chit chat about cosmetic surgery, especially liposuction and fat transfer. Thank you.
Thank you. Thank you so much, viewer. I'm sure you grab a lot from Dr. Akeem Anifowoshe. He has a wealth of experience in this field. If you want to do it, just book an appointment with the right doctor. I see you next time on Be Inspired with Umila Bute, and have a good day. Bye.